Hey Gateway family, it's Dr. Wall. We are going to have a rehab video on how to do tractions the proper way. This doesn't matter if you've been a patient for just a couple of weeks and you're kind of learning how to do the traction to warm up your neck, or if you've been a patient for 10, 15 years. This is going to help all of you because obviously, I want to, Dr. Carter, Brandon, Destiny, we want you to get the best results here in the office. But there's some things that we see patients tend to do the longer they've been here. I don't know where it comes from. Maybe they see somebody else doing it wrong, but we're starting to see some patients not doing the traction well. And I want to show you the best way to do the traction so you get the best adjustments on your neck and your upper back. So I want to show you this because when we come in first, so I've wiped it off, everything, it's set for me. So that's going to be one big thing too. Because I think a lot of people do it wrong because they don't take the time to make sure this is at the right height. So this is the right height for my neck, okay? And before I do it, I'm gonna take my glasses off and kind of show you this. But obviously you can clean this off at your liking, but don't be afraid to raise this to go up and down based on your height. So this helps you quite a bit, not have to really bend too far down. So we wanna make it easy on you. Also, you have this. These are pads that can go together. They can go apart. You can fiddle with these, the ones you have at your house too. But we want to make sure that it has a good fit on you. So let me show you kind of how I would do this. So obviously, we want to put this in the right way, okay? And it's also covering. I got it right above my eyes, okay? I also have this right up under my neck. So it's right up under my skull. I don't have this on my neck. It's hooking into my skull. So I'm hooked in. Also notice that I'm close to the wall. I'm not leaning out. This is going to cause fraying on the ropes and they'll snap, which we don't want. Plus, I see people lean back to do it, that's not warming you up. That's just, you're just maybe stretching, I don't know, but that could also pull a muscle. What we want to do is, I see how my hands are holding this, I'm just going to go straight down into a good traction and then I'm going to come up. I'm going to count to 1. So 1, Mississippi, I come up. Super easy. Notice how I'm not going down, all the way to the ground. It's because I have this high. So this is saving my back and it's saving my quads some, but I'm still getting that good traction. So if you have a bad, back, if you have a bad knee and you can't bend well, hook it higher. That's going to make this easier for you. And I go straight down. I go straight down. I do not lean back and I don't lean forward. I'm going straight down and I'm doing, this is kind of how I would warm up, just like this. You don't want to be going faster than this. And you don't have to you don't hold it there. Don't hold and hang. I've seen people do that too. We don't want to hang. This isn't a noose. This is a warm-up device, okay? So that's how I'm warming up. Super easy, and it's straight down. So I should feel a good pull down. Now what I see, and I'm gonna have to probably show you other ways I see this. So there's a lot of wrong ways, and I'm noticing people doing it, and nobody was taught to do this, but I think we're seeing some other people do different things, but there's really one way I want you doing it, and that's what we just talked about. These are bad ways to do it. So I see people that'll lean back. This is not warming you up. This is just fraying this, and you can snap it, which I don't want you to snap and fall over. I see people that literally lift their legs up off the ground. I'm not gonna do it because this will probably snap, but they hang. This is not a noose. Don't hang from this thing, please. Just up and down, 1 second. The other one I see a lot of people do, they'll put this thing, I can't even do it. Let me show you this. Here, that'll be better. I see people put this thing underneath the jaw. Don't do this. This is for older patients that have been with me for a long time. Years ago, this piece was a lot smaller, and we didn't have these pieces either on the traction, and it was underneath the chin. It is not that way now, and here's why. This is going to force your neck into extension, and when you go down, look at my neck. So I'm actually locking myself here, and I'm putting a lot of strain on my jaw. So what that'll do over time, that's going to give you some TMJ issues. It's going to give you maybe a headache doing it that way. So never put this thing underneath. I know maybe you've been here for 12 or 13 years. You used to do it that way, but the rehab has changed. Again, do it up here. It's going to save your jaw. That's why we do it that way. And everybody should do it that way. Then the last one I see that's done wrong, I'm trying to find all these wrong ways I've seen. This is one that I've seen too. And this one, I'll see people, they'll do this. Okay, this is not the right way to do the rehab. See, this is not, this is doing nothing, okay? That does nothing. That's not how you do rehab. You want to do it, just go straight down. No leaning back, no leaning forward, just straight down and up. Easiest way to do it. You'll traction better, you'll adjust better, and this traction is going to go all the way down to your mid-back. It's not just going to stop at your neck. If it goes all the way down, your upper back adjustments will move better. So again, best practices to do. That's how you do the rehab. And again, some patients, depending on a disability, they might not be able to bend that far down. That's why we hook it a little higher on them. So just bear that in mind. Do how you were told. And if you don't have a disability, if you don't have a cane or something, then do it how I told you. Just get right up under it, okay? Make sure it's at the right height. Get right up under it, hook it under your skull like this, and just go straight down. Just a straight down good pull here, okay? That's how you do it. That's how you warm up. And depending on how many you do, 20, 40, 60, 80, 100. Some people do a lot because we got to warm them up. They're hard to move, but that's going to warm you up the best, and it'll make that adjustment a lot more effective on you. So again, thank you guys.